Next up, we have Dr. Chris Grilli. And so Dr. Grilli completed his Doctor of Pharmacy at Creighton University, and he's been the manager of our outpatient pharmacy here in Mayo Clinic, Arizona for the past several years. And so he's actually been a valuable resource as part of our Center for Individualized Medicine, as part of our Pharmacogenomics program and offerings through the center. Dr. Grilli has always been helpful with providing clinical consults for patients who undergo such testing and in terms of guiding therapeutics for them as well. Thank you, Dr. Grilli. He's going to be talking about pharmacogenomics and primary care.
Thanks, Atul. So it wasn't too long ago that I was in the basement of Mayo Clinic and basically an advocate for pharmacogenomics, and nobody was really paying attention to me at the time. I would talk to anybody I could about this science and tell them that it was the future and it was going to be an enormous impact into the lives of patients pretty much across the spectrum, even beyond primary care. And then in a very short period, something changed, right? So it went from being kind of a hobby to a situation where now I'm in front of all of you talking about pharmacogenomics. And one of the main driving forces behind that was the cost. And I think it's incredibly important for this room to kind of understand the market that's kind of occurring around pharmacogenomics. When I got into it, it was thousands of dollars. It was an enormous expense. We would have long conversations about the ethics of whether or not we should even order the panel and if there was enough utility, et cetera, et cetera. And over the last couple of years, the price has come way down, right? So from thousands of dollars to just several hundred dollars. And so what that's doing is it's creating a renaissance in the science. It's starting to give us a more powerful tool, a clear idea of how this works. And so I'm going to talk a little bit about kind of my process, but I also want you guys to be aware that the market around this is changing and changing very quickly. Right now we're doing genotyping, but that's eventually going to give way to whole exome sequencing, and that's going to be a big deal once that occurs. So I have no relevant disclosures for this presentation. That is not from a lack of trying. Okay, so basically what I'm trying to accomplish today is I want to outline the importance of improving medication selection and dosing. That's a really interesting space, right? And you'll see on the next slide why that matters. Then I'm going to discuss the role of pharmacogenomics.